Welcome to Thought Leadership for the New Normal, a conversation series with Sacred Heart University deans. Today we ask our guests, what will healthcare look like in the year ahead? Join us now live from the campus of Sacred Heart University with your host, Randy Kay.
Hello and welcome, and thanks for tuning into this episode. Today we're talking about a very, very important topic, and it's about healthcare and wondering what it will look like in the year ahead. I'm Randy Kay from Sacred Heart and WSHU, the sponsors of this series. So I want to welcome my guest, Martin Sbriglio, CEO of Ryders Health Management in Stratford, Connecticut. Welcome, Martin.
Thank you. Great to be here.
Yeah, so you were a male student at way back in the day. You don't have to say the year.
Yeah.
Were you the only male at St. Vincent's College at the
my
time?
first year attending, I was the only male in the school, I came from an all-boys school to high school, boarding school, to an all-girls school. So it was quite a revelation for me. But it was a wonderful experience and a great program.
So let's begin with the first question. Obviously, this whole series is about the current crisis and COVID-19, and it certainly affected all of us. One of the things that's very clear is it has pointed out some of the weaknesses in the healthcare system, which can really be a positive because now we know what has to be fixed. What should we reevaluate? What changes should we make to the system?
This is a big question to address, and I know that the history of mistakes made to this point was really what exacerbated the crisis. We had in Connecticut, specifically in previous administrations, where they decided that funding for the healthcare industry as a whole was not important, and they really were directing funding into other areas.
So you're talking political administrations?
Yes, I would say
local and state level?
I'd say the state level,
Okay.
primarily. Connecticut is unique. Previous governors, previous legislatures, previous senates have really defunded the healthcare industry, specifically skilled nursing facilities, in a dramatic way. Imagine if 70 colleges went and closed in Connecticut. What would you say about the condition of the college situation in Connecticut? I think most people would agree that we have a problem if 70 colleges went bankrupt and closed. Well, that's exactly what happened over the last 15 or 20 years to skilled nursing facilities. The state of Connecticut, I'm not blaming the current governor.
Right.
This is history. They decided they wanted to right-size and rebalance. They decided they did not want to fund skilled nursing facilities. They wanted everybody to go home. So they stopped funding skilled nursing facilities in an adequate fashion, and 70 facilities went bankrupt and closed. So previous to the COVID crisis, we saw thousands of patients die because of transfer trauma. On our YouTube channel, Honest Healthcare, we started interviewing before the crisis arrived, where we were starting to talk to employees who witnessed 20% of the patients died once discharged from a facility that was forced to close due to Medicaid inadequate payments. So many patients died, but the media and, of course, the agenda of the state and previous administrations, again, not Governor Lamont's, really directed funds everywhere else except patient care. So given that situation, we entered into this COVID war in a handicapped condition. That being said, Marianne said that the staff have performed flawlessly. The nurses, I can give an example. We had this incredible nurse, went through a year of chemotherapy, and obviously immunocompromised.
The nurse did?
Yes, she did.
Okay.
One of our nurses. Incredible nurse. She received the Florence Nightingale Award. I won't mention her name. She may be embarrassed. But after a long course of chemo and doing very well, she came back to work, and the COVID crisis hit. And in fact, during her chemo, I would say she was still working. Immunocompromised, she was on those floors, taking care of patients, holding a patient's hand who was on hospice care, with the proper PPE, of course, and the proper precautions, but praying for this patient. So to your point, the staff and the nurses and the aides did amazing work. But we approached this from a human standpoint, and we had to. but the resources were restricted. And I think the COVID crisis has magnified the mistakes of the past.
Okay, absolutely. And, underfunding, I'm very aware that that is an issue, and I've been involved with many organizations that are working with fewer and fewer dollars that could be allocated to them. I had no idea that 70 skilled nursing facilities had gone bankrupt. That's
Yes.
an amazing and horrible statistic, actually.